I'm Dr. Arthur Kaufman. I'm the Vice President for Community Health at the University of New Mexico in the southwestern United States. I also finished recently an 8-year term as the Secretary General of the Network Towards Unity for Health, which is a non-government organization in official relations with the World Health Organization. I've been aware and worked with from a distance AUPA for years since its inception. I had the honor of participating in a workshop, visiting in Catalonia, Barcelona on several occasions, and have watched the evolution of the project from 8 health centers to now over 20, with rather extraordinary and model interventions in community health. I think that the way this has evolved is very much a unique model that we can learn from in the network. The network being over 200 academic health centers from around the world. About 2/3 of them are in developing countries, and the purpose of the network is to share educational and service innovations and learn from each other. We meet annually in a different WHO region. We have a Medline indexed journal which we publish and learn from each other. And I wanted to talk a little bit about why I think AUPA is so unique. Spain and Catalonia have an advantage, certainly over the United States and some other countries, in that it has a universal health care system. But it also has a system in which primary care centers cover geographic populations, so really the whole population is covered. Also, there is much experience in Catalonia, and certainly with the leadership of AUPA, in community-oriented primary care, COPC, and those are all kind of the seedbed for why I think AUPA's innovations have been so successful. One of the important elements of AUPA that we have actually adapted in New Mexico, and that is of enormous importance to the network, is that the design of the clinical services is driven by the community's priority needs, where you actually use the epidemiologic data about priority needs in that community, where that informs decision-making about clinical services. And they go beyond traditional clinical services within the 4 walls of a clinic, and addressing social determinants of disease, which are so important as leading factors causing ill health. This project has been presented to different network meetings, and we're trying to have some of the schools emulate that model and disseminate it. Of course, the group from AUPA also learned from other schools to strengthen that model, and so it's like a combined group of schools learning from each other.